And this morning's Health Watch, getting gout. This especially painful form of arthritis is now showing up earlier than ever. Medical correspondent Dr. Jennifer Ashton has the very latest for us this morning. Doc, good to see you.
Good morning, Chris.
So exactly what is gout? And let's talk a little bit more about this study as well.
This is basically an inflammatory arthritis caused by high levels of something called uric acid in the blood, heavily tied to our diet, which we'll talk about in a minute, and really typically affects the great toe, and it gives you a red, hot, painful joint that really gets your attention. Now, researchers at Boston University recently looked at federal surveys of gout diagnosis. They looked at it in the 90s, revisited again in 2007, found that over that 2-decade time period, the prevalence of this disease has increased by 44%. That's significant because it's often misdiagnosed and it's affecting younger and younger people.
So what do they attribute this increase to? Why now?
Well, largely diet, obesity, hypertension. You can think of this as the equivalent to the diseases that, like diabetes, high cholesterol, high blood pressure. Okay. You can't see those diseases. This one you can see and you can feel, and really is related to those factors.
What are the, I guess, the main symptoms of it? How do you know when you have it?
Typically, if you speak to people who have gout, and I have some patients with this, and we spoke to many doctors, they really say the primary symptom that brings people in: pain. So this typically can be pain in a joint, usually the big toe. It can give you redness. Really, it will blanch and kind of appear pink visibly, and it really also can give you swollen joints. People can say their ankles can swell, and we spoke to a patient who had been misdiagnosed, Chris, for 11 years because this is really not on the forefront of doctors. They think, look for this in the elderly. Now we're seeing it in middle-aged men and women.
Okay, let's talk about how you can avoid it, and if you do get it, then how do you control it?
Again, this is one of those things that if you heavily modify your diet and things that you can control, you can really reduce your risk. So you want to reduce things like high purine diets, which are meats. Alcohol can be triggers. People have individual food triggers. And then in terms of treatment, things like non-steroidals, a medication called colchicine, steroids, all can be useful.
All right, Dr. Ashton, thanks so much. Good to see you.